Well, when we do our checkups, I always ask if they grind their teeth, and of course, everyone says no, but I see signs in their teeth that they are grinding, so I check them and then get them fitted for a night guard. And for some people that have the sleep apnea, we also do sleep apnea appliances, and that's a little more specialty care, specialized care, but we can do that. But most people, if they do the night guard, it will also prevent some of the snoring, and it provides comfort because their teeth are separated while they're asleep. So it that their joints, the TMJ joints, are relaxed and they get better night's sleep.